If you're considering IVF, the whole egg retrieval part can sound, well, pretty intimidating. So in this explainer, we're going to pull back the curtain on the entire process, using expert info to give you a really clear and hopefully reassuring look at what it's all about. Here's our game plan. First, we're going to tackle the #1 worry that pretty much everyone has: pain. Then, we'll get into what the procedure actually is, how pain is handled, what your day will look like from start to finish, and wrap up with some of those other questions you might have. All right, let's dive right in and talk about the single biggest question that comes up for anyone even thinking about this journey. This is it, the big one, the question on everyone's mind. And you know what? It's a completely fair question, and it deserves a straight-up answer. So let's just cut to the chase. The most important thing for you to know, right here, right now, is that the whole process is designed specifically for your comfort. The vast, vast majority of patients feel little to no strong pain at all. Okay, so hopefully that puts your mind at ease a little bit. Now let's build on that by talking about what egg retrieval actually is. Sometimes just understanding the mechanics of it makes it all feel way less scary. So, in simple terms, think of it as a really precise and delicate procedure. A specialist uses a transvaginal ultrasound, which is like a little camera, to guide a very thin needle. This lets them gently collect the fluid from the follicles in the ovary, which is where those mature eggs are waiting. And here's the part that really surprises most people. The actual procedure itself is so fast. Seriously, we're talking just 10 to 20 minutes. That's it. So you might be thinking, okay, 10 to 20 minutes, great. But how exactly do they make sure it doesn't hurt? Let's look at the standard approach, especially in a place like Malaysia, which really puts patient comfort first. The key is something called IV sedation. It's a form of light anesthesia that puts you in a really calm, sleepy state. You won't feel anything during the procedure. And honestly, most patients say they don't even remember it happening. Afterwards, you might feel a little bit of a dull ache, kind of like period cramps, but it's nothing that some simple painkillers can't handle easily. You know, it's actually helpful to understand where that idea of a painful procedure might have come from. A lot of people get this image in their head, and it often traces back to hearing about practices in other countries, like Japan, where some clinics might use only local anesthesia or sometimes none at all. But in Malaysia, the common standard is IV sedation, and that just makes a world of difference for the patient's experience. And I know what you might be thinking. Anesthesia itself can sound a little scary, but it's so important to know that your safety is the absolute top priority. The medications they use are very short-acting, and you have a whole specialized medical team monitoring you the entire time. All the protocols are super strict and meet global safety standards. So we've covered the what and the how. Now let's walk through the when. What does the actual day of your procedure look like? Knowing the play-by-play can really help calm any nerves. The whole day is actually very streamlined and predictable. You'll get there, check in, and get prepped. Then the sedation is given, and that super quick 10 to 20 minute retrieval happens. After that, you'll just chill out in a recovery room for about an hour. And once the team sees that you're feeling good and stable, you get to go home that very same day. Okay, this next part is a really, really important logistical point. While the recovery is super quick, you absolutely cannot drive yourself home after you've had anesthesia. So you've got to plan ahead and have a partner, a friend, or a taxi ready to pick you up. But the good news is, most people feel totally fine to get back to their normal routine like desk work the very next day. All right, so besides the big questions about pain and timing, there are a few other practical things that pop up all the time. Let's run through those really quick. So we've talked about getting back to work pretty fast. But what about the results? It's so easy to get fixated on the number of eggs, right? But what your doctor will tell you, and this is so important, is that the quality of the eggs is just as, if not more important. A few really high-quality eggs can be much more successful than a whole bunch of lower-quality ones. And as for how many cycles you might need, well, there's just no one-size-fits-all answer. That's a completely personalized plan your doctor builds with you, based on everything from your age to your fertility goals. So, if you take away just one thing from all of this, let it be this. The reality of the egg retrieval process is almost always way less scary than the anxiety you feel leading up to it. It's a quick, safe procedure with really fantastic pain management. And that brings us to our final and maybe most important thought. This whole journey can feel so overwhelming, but you absolutely do not have to figure it all out alone. The best thing you can do to fight that anxiety is to get information and support. Just taking that first step to have a conversation with a specialist can change everything.